Did you know that over 70% of students who struggle with pharmacology fail their NCLEX on their first attempt? That's because pharmacology is not just about memorizing drugs. It's about understanding how they work in real life scenarios. But guess what? If you master the top 50 commonly tested drugs, you'll get way ahead of all those test takers. Hey everyone, welcome back to another episode of NCLEX-RN series, where we break down all the complex topics and make them simple and fun. But before we dive into today's topic, you must be wondering, why am I all dressed up in sari today? Yes, today is Saraswati Pujo. Happy Saraswati Pujo. This is a very special pujo for us Bengalis, where we worship the goddess of knowledge and wisdom, Saraswati Thakur. It's a day when students and learners honor her for guidance into their studies. So what better day to learn about pharmacology, right? Alright, now let's jump in. Before we start our today's topic, let's quickly answer the question I left you with in my last episode of Prioritization and Delegation. Because I saw so many of you dropping your answers in the comments, and some of you nailed it. A huge shout out for Anjali Matthew for answering it correctly.
Here's the question. You're the charge nurse on a telemetry unit. Which patient would you see first? Number 1, a patient with atrial fibrillation who is stable and receiving anticoagulants. Number 2, a patient post-op abdominal surgery who is complaining of severe pain despite receiving morphine an hour ago. Number 3, a patient with heart failure who has gained 3 pounds in the last 24 hours and has new onset crackles in the lungs. Number 4, a patient with chronic COPD who is requesting assistance with their oxygen nasal cannula placement. And the correct answer is option 3. Why? Because sudden weight gain and new crackles in the lungs signal fluid overload, which can quickly lead to pulmonary edema, a life-threatening emergency requiring immediate intervention. Amazing job to everyone who got it right. Now let's talk about pharmacology, one of the most feared topics of NCLEX. But don't worry, by the end of this vlog, you'll feel more confident, and I'm confident about it. So grab a notebook, get comfy, and let's get started. So today, I'm giving you high-yield mnemonics, must-know drug categories, side effects, and some practice questions so that you're exam ready. Alright, let's start with some absolute game-changing mnemonics, which can give you an idea about some drug categories and their side effects.
First up, beta blockers. The LOL drugs, used for hypertension and heart failure. The easy mnemonic for this drug is atenolol and metoprolol keep the heart slow and low. What are the side effects? Side effects of this drug is B for bradycardia and B for bronchospasms. So avoid in asthma patients. Next is ACE inhibitors, also known as the Pril drugs. Think lisinopril, enalapril, captopril, etc. For mnemonics, just remember April for ACE inhibitors. A for angioedema, P for potassium which is elevated, R for recurrent cough, I for itchy skin, and L for low BP. They drop blood pressure but watch for that nasty cough and high potassium levels. Now let's talk about a must-know for NCLEX. Digoxin, the heart savior but also the silent killer. Digoxin toxicity is a life-threatening condition. Watch for nausea, yellow halos, and bradycardia. Hypokalemia and kidney issues increase risk. Always check for potassium and creatinine in this condition. and antidote for this is Digibind. NCLEX tip is hold if heart rate is less than 60. Now let's apply what we just learned in some real life NCLEX questions. A patient on warfarin has an INR of 5.2. What's your priority action? Number 1. Continue the medication as ordered. Number 2. Administer vitamin K. Number 3. Give an extra dose of warfarin. Number 4. Encourage the patient to eat more leafy greens. Now, think about your answer wisely, pause the video, and when you're ready, resume it. The correct answer is obviously option 2. An INR above 4.5 is a red flag for bleeding risk, and vitamin K is the antidote. Let me give you a small tip. If you see INR is more than 4.5, then obviously think about vitamin K. Next question. Which patient on opioids should the nurse see first? Number 1. A patient reporting nausea after taking morphine. Number 2. A patient with a respiratory rate of 8 after receiving hydromorphone. Number 3. A patient asking for their next dose of oxycodone. Number 4. A patient with constipation due to prolonged opioid use. Now, as usual, think about it wisely, pause the video, and then when you're ready and sure about your answer, resume it. Yes, you're right. Correct answer is option 2. Respiratory depression, where the respiratory rate is less than 12, is the biggest danger with opioids. If a patient's respiratory rate is 8, that's an emergency. Give naloxone as soon as possible. Alright, before we wrap up, I have another challenge question for you guys for this episode. If you know the answer, you know what you have to do. You just have to comment in the comments section and get featured in my next episode with your correct answer.
Before I go, I have a challenge question for you all to test what you've learned today. Drop your answers in the comments below and I'll reveal the correct answer and explain it in the next episode of this series.
Here's the question for you. A patient is prescribed vancomycin IV for MRSA. Which assessment finding requires immediate intervention? Number 1. Red rash and flushing on the neck and chest. Number 2. A blood pressure of 110/70. Number 3. Complaints of mild nausea. And number 4. A serum creatinine level of 0.9. What do you think? Let me know in the comments and I'll reveal the correct answer in the next episode. If you found this helpful, please like, comment, share and subscribe to my channel so that I can make more and more vlogs on this topic and guide you along this journey of NCLEX-RN. Don't forget to hit the bell icon so that you never miss my episodes. Until next time, happy studying and remember, you've got this.